The virus enters your body. Typically, you're going to get it in through one of three passageways: your eyes, nose, and mouth, probably mostly your nose and mouth. And once it hits the back of your throat, that's where it starts its journey. It starts infecting cells and gets down into your lungs. And that's been the story for most of this outbreak. We've thought about it as a lung disease and talked about it as infecting, the little alveoli and causing damage to the lungs. And I think what we're learning now, you asked me about kind of what's the bleeding edge. I'll tell you, it's the blood. And so as you go across from the lungs into the blood vessels, it's what's happening in the blood vessels. And I think that's what we're starting to realize right now. In the past few weeks, we've seen more and more studies talking about strokes in young folks. And so someone your age shouldn't be getting a stroke. You're a healthy person, presumably. And now we're seeing strokes in people your age, my age for sure. And that's worrisome. People have thought up until now it's a disease of old people and it's a disease of lungs. And now you tell them, well, there's an actual increased stroke risk, and that's because it causes endovascular damage. It's literally infecting the cells that line the blood vessels and damaging them. And what does that sound like? Well, that sounds like what sets up for a heart attack or a stroke. And that's, I think, the increasing realization that people are having about SARS-CoV-2 or the virus that causes COVID-19.
Yeah, the notion of what's going on in the blood to me is really interesting. It certainly points at things that we can do to ultimately defeat, if I can use that word, the virus. Getting into what's really going on in those cells that are lining the blood vessels, what's actually happening? What is the damage that it's doing?
So the first thing I'll say is that think of it as a numbers game, right? So you just mentioned a really classic example. You think of it touching you and it getting in and it taking 5 seconds to do so. That's not how I think of it. I think of it as if there's a lot of it, then yeah, I'm in trouble. If there's a little bit, I'm not in trouble. So there are a number of innate immune defense systems you have in place. And, it's a little bit like, think of another numbers game, sperm creating fertilization. There are a number of reasons why a sperm wouldn't make it to an egg. And it's only because we, have millions and billions of them that you get one to survive. It's a numbers game. Similarly, the virus is trying to play a numbers game. It's going to get stuck by mucus. We have little proteins, defensins within that mucus that are going to deactivate or attach to the virus. We have mucosal antibodies. We have local monocytes. You have all sorts of things set up to allow for you to not get an infection. And if you get overwhelmed, if you get too much virus, then yeah, maybe you'll get an infection. Maybe some cells will get hijacked. Even when they get hijacked, there is a numbers game on the other side. Getting one cell infected, technically you might think of that as an infection, and maybe some would agree with you. Others would say, well, an infection is when you can detect it. Well, what's the detectable threshold? Is it a single cell? Can we detect a single cell infected? Not really, not that I've ever seen. So you have to have enough of an infection to even detect infection to call it infection. And again, that's a numbers game too. And the reason this matters is take two scenarios. I'm in a grocery store, I grab an apple, someone sneezed on it 2 days ago. There was a tiny amount of virus on it 2 days ago. That's been steadily decreasing as the ambient temperature and humidity in the grocery store is causing the virus to essentially die off. And so the actual threat is pretty low. It's a very, very tiny amount of virus on that apple. But comparing now that scenario to another scenario where you're a healthcare worker, you've intubated a patient, they coughed in your face, they got a lot of inoculum. Then you move to patient 2, they coughed in your face. Patient 3, they didn't cough, but they sneezed 10 minutes before you walked in. You're getting multiple large inoculums of virus. When you go home that night, you're dealing with a lot more than that person with the apple. So these are two different scenarios, and so numbers matter. And that's why we're seeing so many more healthcare workers that are in that setting get sick when they're healthy and otherwise kind of able-bodied, when in other scenarios you don't see those same attack rates. So that's the first point I want to make. Now, the second point is what happens when a cell gets infected. You correctly point out cells, viruses don't walk around. In fact, that's why isolation works. They don't cross highways or walk across the street. They don't walk around your body either. And so when a cell is infected, that cell might lyse, it might break, and the stuff inside might come out. Where does it go? It goes to the immediate vicinity, right? It goes right into that area. Now, there is some aerosolization and things like that we know, and you make bioaerosols even when you speak. And so it does actually make its way out into the environment through that mechanism. But it itself is not moving. It's hitching a ride on a little droplet of mucus, and that's its ride. That's its Uber to get into your workspace.
So as you think about like protecting yourself and your family, like the more that we understand what the virus is doing, in fact, I'd love to hear more about the ACE2 receptor, how that works, and how that influences how you think about keeping yourself safe.
Sure. A couple of concrete things that I do. So I try, and I'm not perfect at this, and I don't expect anyone to be, but I try to batch my grocery shopping. I try to batch my errands and say, let me do one errand and hit up a few different spots, and so I don't have to keep going back out again. Every time I leave the house, that's a chance, especially if I'm going to an enclosed space where there's not as much ventilation. When you're outdoors, I'm going to the park, that's a different ball of wax than if I'm going to a store where the ventilation, even though they of course have HVAC systems, they're not ventilating nearly as well and effectively as an outdoors area with a breeze. So it's all about dilution. If you can dilute the virus, whether you do that with water when you're washing your apple, whether you're doing that with air as you're going through an outdoor space, whether you're rolling the windows down in an Uber, if you're in an Uber, anything you're doing to dilute is stacking the deck in your favor. So that's the first thing. Minimizing trips to high-risk locations. High risk is anything that's enclosed. So again, like minimizing and batching your trips. That's the second thing. The third thing is when you're in your home, cohorting yourself to your home. So it's just me, my wife, my son, my dog, right? Like that's our cohort. We stay together, and we don't, our son isn't going off anywhere else. We're staying as a unit. And so that's the best you can do, is kind of keep your unit safe. If you guys get sick, likely it's everyone in the house that's going to get sick. So protect everyone and make sure everyone's making the same smart choices you're making. Masks and coverings. There's a lot of data now on the fact that they're probably helpful and probably need to be mandated, frankly, especially in indoor settings. So that's another thing that people can do, is just cover their mouth. It protects the source, so you're not spitting it out. Even if you're talking, as I said, you can get it out there. But also protects you from inhaling it. And there are masks that you can make at home that have pretty good effectiveness at getting viruses screened out, believe it or not. So we can talk about that as well. And the one, I'll just give you the answer there, is polyester. Seems pretty effective with kitchen towels inside. So that's a good strategy. So those are some concrete steps you can take to minimize your chances of getting sick.
So talk to me more about the ACE2 receptor. So what's going on there? Why is your money on that?
Yeah, so when you look at the ACE2 receptor, it's a receptor that sits on the airways, and we know that that's where the spike protein, you alluded to it, it's called coronavirus because it looks like it has a crown under a microscope, and corona means crown. So it looks like it's wearing a little crown. Well, that crown is studded with little proteins. Those proteins that are studded in its crown are spike proteins. So those are the proteins it's using to attach. What is it attached to? It attaches to a receptor. We call it the ACE2 receptor. That receptor, it's lining many cells. It's lining the cells of the airways, but also it's loaded in the blood vessel cells. So those cells have a lot of ACE2. And as we're seeing more and more disease in the blood vessels, one hypothesis is that that's how it's causing the disease. We know it binds to ACE2 already. Those cells have it. Logical conclusion is probably what's happening. And so my money is on that's where it's binding, and that's why it causes a lot of disease. Now, there are some ideas. Like, what if you, for example, inject someone with soluble ACE2, where it's kind of free-floating? That ACE2 could bind up the spike protein. And therefore, the spike protein can't bind to your ACE2 because it's already bound to this soluble ACE2. So there are ideas out there, and these are more than just ideas. These are actually, some of these are in randomized controlled trials where they're trying to see if this is a strategy to try to minimize the infectivity of the virus. So this is out there, and this is why I'm betting on it.
What do you think about cardio? So I despise cardio. I really only do cardio when I'm really trying to get lean. But legitimately, about 7 minutes ago, I thought the second this interview is over, I am going to a treadmill, because if this is around the ability to lung capacity, red blood cells, getting
move oxygen around,
getting my cardio on point, might be truly something to really consider.
I agree 100%. I'm with you. I don't love cardio. I'll do it if it's in the context of something that I enjoy doing. Like, I like to surf, I like to ski. I'm not doing obviously either of those right now. I like to ride my bike. I think really anything that improves your blood flow right now. So even strength training, although it's not necessarily increasing lung capacity, it's probably increasing blood flow, which is a good good thing to do right now. Of course, diet is critical always, but it's even more so now, especially if you're someone who's at risk for, higher blood sugar. The reality, at least from what I am reading and seeing, is that this is, while we might reach the peak number of cases from this initial wave in the next couple of weeks, COVID's not going anywhere anytime soon. And, I wish that were not true. But this is likely going to be with us in some capacity for 12 to 18 months, and maybe even seasonally for until there's an effective vaccine developed. So what this means is that it's not just a question of like, what do you do tomorrow or in the next couple of weeks to prepare? It's what do you do for the next year or two and going forward to reduce your risk. And one of the most important things for sure is to control your blood sugar. So if you're someone who's got pre-diabetic or diabetic level blood sugar, then taking action through diet to lower that blood sugar considerably and get it back into normal range, I would think is probably one of the biggest ROI things you could do. So that could be a low carb diet, a keto diet, protein sparing modified fast. There are a number of dietary approaches that have been proven to be effective for diabetes, but it also means strength training, getting enough sleep, managing your stress. All of these things are also really important when it comes to lowering blood sugar. Like just stress alone, which is hard to avoid right now, raises cortisol. And what does cortisol do? What's its main job in the body is to raise blood sugar when it falls too low. Now, that was an evolutionary mechanism when we would go periods of time without eating and our blood sugar would drop. Cortisol would be there to keep it stable, but that backfires on us now if most people's blood sugar doesn't ever fall too low and cortisol is just raising it to unhealthy levels. So those are, I think sleep, physical activity, exercise, strength training, cardio, stress management, which is even more critical now than ever before, and a diet specifically a diet that manages blood sugar levels are probably the most important things people can be doing right now.
If you want more advice, wisdom, guidance from other successful entrepreneurs on how you can navigate the coronavirus situation, check out the video right there next to me. I hope you find it valuable. Continue to believe, and I'll see you there.
This certainly has taken over the mind space of the world.